Hello, ladies and gentlemen. Welcome to today's program of the situation. Sometimes we get to a point where we no longer know what's happening around us. We can't always change what's happening around us, but we can change what's happening within us. This program, The Situation, creates situational awareness and brings you up to date with the ongoings around the world. We believe that by putting you in the know about what's happening around the world, a change can be triggered within you, and only then can you change what's happening around you. This week's edition of The Situation focuses on Kenya. We are interrogating how well Kenya is prepared to handle disasters of the COVID-19 caliber. To bring us up to speed with this debate is Martin Munene Brown. Martin Munene is a disaster expert, a graduate of the King's College London, and a PhD researcher at the London School of Economics and Political Science. Welcome to the program, Mr. Martin.
Thank you, Daniel, for the opportunity to reflect on such an important and pressing matter as the coronavirus disease, or the COVID-19 as it has come to be known. But before I answer your questions and make my comments, I would like to express my sympathy to the thousands of families, and especially to the families of about 300,000 people that have succumbed to the COVID-19 pandemic. Now, I know, these are very trying times for many of them, and especially some of them that will be listening to our debates or our discussion. This is not easy, and I understand the gravity of the question we are going to address today. So from the onset, I would like to express my sincere condolences to them and sympathies to all those people that have been affected.
Now, to kick us off, Mr. Martin, now, the disaster landscape in Kenya is characterized by various natural hazards like droughts, floods, and disease. Now, how well is Kenya prepared to handle these natural disasters?
First of all, before I continue, I want to make it clear that I do not subscribe to the idea that there are natural disasters. Disasters are not natural. The terms you have used, natural hazards and natural disasters, are not synonymous. They are different. That natural hazards are events that come from natural processes. They have origins from nature, for instance, floods and droughts, as you have mentioned them. Now, calling them natural disasters removes the role that we humans play in making them disasters, and we have a very, very critical role in transforming mere natural hazards into disasters that they are. Now, the natural hazards you have mentioned have different profiles, and therefore to address them you have to employ somewhat different approaches. For instance, you can't employ an entirely the same package or toolkit of approaches in dealing with coronavirus or in dealing with floods as the one you would apply in dealing with the droughts. Now, how is Kenya prepared to deal with some of the disasters? I hate to be pessimistic, but I categorically think that Kenya is unfortunately not very well prepared to deal with these disasters. And my conclusion is based on the observations of the past and even the present. Now, we've had quite a good number of droughts, floods. As currently we are dealing with the floods, we are dealing with the locusts, we are dealing with the COVID-19, and all these, there is a lot of improvement that needs to be done to say that Kenya is well prepared to deal with such disasters. Now, to be more specific, to be able to answer this question, you would ask yourself, what are some of the institutions that are established to deal with, for instance, to deal with such disasters or hazards? What are the institutions established? What are the policies that exist? What processes are involved in dealing with these disaster risks, and what are the actors there, and how do they interact? Now, I know I will get back to how Kenya should tackle some of this, but from this point, I would want to say that I do not believe that Kenya is well prepared to deal with many of these disasters. I don't know one disaster that Kenya is prepared to deal with. We have not proven ourselves any different in the past, and even currently we are falling short of an effective disaster risk management system.
My second question to you, Kenya has participated in both the Hyogo Framework for Action and Sendai Framework for Disaster Risk Reduction, and it is also a subscriber to the African Risk Capacity, that is an insurance scheme. Now, how can Kenya benefit from these international processes?
Yes, Kenya has ratified or is a signatory to quite a number of international conventions, treaties, or mechanisms such as the ones you have mentioned. So the Hyogo Framework for Action actually expired in 2015 and has been replaced by the Sendai Framework for Disaster Risk Reduction. Now, how can Kenya benefit from such processes? Now, these processes for you to benefit from these processes, first of all, you need to participate in them. Now, Kenya participates in almost all of these international processes. Kenya is almost amongst the very first countries to ratify some of these conventions and frameworks. But how they are implemented at home, how they are localized, how they are made to work for the country is something that we have not seen very well. But I would like to say that, well, there are a number of ways a country like Kenya could benefit. Number one is that Kenya could learn from the peers within whatever frameworks there are the country is in. Now, the Sendai framework, for instance, has majority of the countries of the world have ratified them, and we have targets. For instance, among the 7 targets that we have now for the period since 2015, when the Sendai framework was adopted, is to have to increase the number of countries that have either national or local disaster risk management policies. Now, I don't know whether we can say Kenya has done very well in terms of passing policies and laws that would enable us to manage disasters and disaster risks more effectively. So Kenya could learn from the peers within such frameworks. Secondly, is that such frameworks come with some resources and technical assistance, and Kenya could benefit from such capacities, from such resources, from such technical assistance that comes from their participation in such processes. For instance, government institutions can get capacity building from the United Nations Office for Disaster Risk Reduction, can get technical assistance on disaster risk management from other development partners that are supporting this process. Now, the other way I think the country could benefit is also by building its own institutions, and especially the institutions that participate or that lead the country into participating in these processes. So yeah, there are a number of those ways. We can get resources, we can get capacities, we can get the lessons from the peers, but also we can manage we can help ourselves into the possibility of raising the profile of disaster risk management in the country by way of not only participating in these conventions, but also making them work for us as a country back at home.
The UK Department for International Development, DFID, commissioned a study in order to understand Kenya's preparedness for natural disaster at the national and the sub-national level. Among their findings was the absence of a culture of preparedness. They also found out that the country appears to be well prepared when it comes to droughts. Now, how can Kenya borrow a leaf from their preparedness in dealing with the droughts to combat the disaster they are staring at right now?
Well, as I said from the beginning, I do not think that Kenya as a country has dealt with the droughts and floods and other disasters that we have encountered before very well, and therefore I don't think we can say that there is a lot of brilliance that can be borrowed from drought preparedness or dealing with the risk of drought in the country import that into the coronavirus or the COVID-19 management. So, but I do not, again, also want to be seen as being utterly pessimistic, and mention that there are quite some brilliant institutions that are working, especially in the field of drought risk management, such as the National Drought Management Authority, and mobilizing other government and non-governmental institutions and agencies to deal with the problem that we have encountered and we continue to encounter of droughts in the country. That said, there are a few lessons which we can draw from the past in dealing with from our experience in dealing with the disaster risks such as drought. First, the importance of institutions. Now, the institution like the NDMA that I have mentioned is one of a few other institutions that have that exist in the country that deal with the droughts, but we do not have such for COVID-19, of course, because it's a new pandemic. It's a new disease. That's why it's called novel coronavirus. But that said, we have institutions that deal with general matters of health. Now, how do they deal with them? How have they dealt with past cases such as Ebola, for instance? One of the things that I have observed, and I think this also applies even to drought preparedness, is the lack of it, the lack of preparedness. A lot of the measures that are put in place by these governments or other governmental agencies are so ad hoc that you would be forgiven to say that there has been a lot of effort put into thinking about them and preparing to deal with them. Now, things such as droughts should never be emergency, should not become disasters eventually, because these are things that they occur quite slowly. We can monitor the FAO, Food and Agriculture Organization of the United Nations, has been and continues to monitor such disaster risks and disseminate some of this information to the relevant government agencies. But in the past, we have seen them being dismissed and, as alarmists, and the results of the same have been quite disastrous. So I don't think there is much to borrow from our drought preparedness.
Another question to you, Mr. Martin, is how should the government tackle the COVID-19 pandemic?
A very interesting or a good question regarding to how the government should deal with the COVID-19 pandemic. Now, from the disaster risk and disaster management perspective, there are a few points I would like to see from the government's action. Of course, some of these are being implemented because the government is already dealing with the pandemic. But some of the points that I want to mention here are some points that are not very popular, that would not be very popular amongst some quarters. The first point I would like to make is that the government needs to deal with this COVID-19 as the pandemic it is, deal with it with the urgency, the seriousness and the consistency it deserves. All this while ensuring that the government protects the people. And in this case, I don't mean just the people that have been affected by it, but also the people that would be affected by the response actions or by the interventions put in place for COVID-19. Then ensure that people stay healthy, keep people healthy. Number two, reduce the exposure. Of course, we have seen a lot of some of these measures being implemented by, through what have been called lockdown measures. Closing off some quarters, some sections of the society, especially in some urban areas, Nairobi, Mombasa, having those containment measures put in place to ensure that at least the disease or the COVID-19 virus does not spread, but also ensure that the measures that have been put in place do not jeopardize the existence of other sectors, and I'll come back to that later. But the other point I want to mention, and this is important, is that the government needs to not deal with this matter as a passing emergency. This is not an emergency that is going to just disappear. It's not like a flood that occurs after some time. Within a few hours, the waters have either receded in the river, or at least we see the floods stopping, and then of course the aftermath of the floods being felt. But this is something that is going to be with us for at least the foreseeable future. Now, some of these measures that have been put in place, like locking down entire communities, is not something that is going to be sustainable. It needs to be done in the initial stages, but at the end of it all, need to ensure that we have mechanisms to transition from that emergency period to a period where we can be able to deal with this pandemic while still the other portions of the society and of the economy are running as they should. Now, the other issue is the investments that need to be made. The government of our country has not been very generous to the research community. It has not been very generous to the health workers, has not been very generous to the health systems themselves. But I think this is something that we need to learn from this and invest massively in research, not just for COVID-19, but other areas of our social life that need to be well understood. But for the time being, need to understand what the nature of this virus, and also the impact of the COVID-19 to the society or the various sectors of the society. Now, if we do invest in this research, we also need to be ready to adopt some of the recommendations or act on the findings of these research projects that we will undertake. Now, the other issue is that the COVID-19 is quite a multidimensional problem. It's a multidimensional pandemic. It will not just affect our health, it will affect our economy. It's affecting all sectors of the society that I know. So when we are dealing with it, we need to deal with it as the multidimensional issue it is.
Last but not least, what lessons should the government borrow from Italy, Spain, the United States of America, and any other or all other countries that are hard hit by the COVID-19 pandemic?
This question needs to be approached carefully because we are not yet through the pandemic. Some of the countries that appear to be doing very well now may not be said to be to have dealt with the COVID-19 very well in the long term. Of course, we have seen this from, for instance, the US. From the time there was like a few cases, and then we thought that things were all right, and then now they have surpassed China. Another case example, Tanzania, we had even people from some international institutions and organizations saying, well, the Tanzanians approach of not closing down or letting things run as usual was commendable. But the last couple of days we have seen the spike in numbers, and this would therefore help me make a point that some of the countries that right now seem to be dealing with the problem very effectively may not necessarily be the ones that may not end up being the ones that have dealt with it the most effectively in the long term. But there are a few things which we can some lessons we can draw from some countries. One, that institutions that work are useful in addressing such pandemics or such disasters. Institutions that work. From then on, what kind of institutions are we going to build as a country? Are we going to build institutions that are robust enough to handle problems or challenges of the future, such as these pandemics? Number two, how much are we investing? How much are we investing in, for instance, understanding the world we are living in? How much are we investing in research, for instance? Now we have countries that have trials or preclinical and even clinical trials of the COVID-19 vaccine. Where is ours? Of course, you may have heard of some stories where there are some people within the country that have developed some vaccine, but the protocols to take this through to trials is not quite cooperative. The institutions involved are not quite cooperative, and I heard some people took this their innovations to another country, which I will not mention here, and it was approved very effectively, and now they are already in the process of trialing these particular vaccines. Right now is not the moment for making political scores. In most of the countries that have dealt with this problem, they have not. Of course, I wanted to say they have not politicized the issue, but I am aware that mentioning the word politics in Kenya can have different connotations, but I mean, we have dealt with this problem as a serious issue. It's not something that you can talk away. You cannot talk away COVID-19 in political rallies. You cannot just debate it away in a parliament and not do anything. We cannot report it and not act on it and then things are okay. Just like we have written a lot of reports in the past and no one has acted on them. This is something that is going to affect us profoundly, and if we do not deal with it with the seriousness it deserves, it's going to wreck our society.
And what lessons should the public learn from these countries?
Yeah, what lessons should the public learn? Now, our Kenyan public, the capacity for us as a people to learn and follow through with the lessons that we learn is quite is not super. It's not super good. If we want to learn lessons as a country, there are so many lessons in the history of our country that we could learn from, but we haven't. But if there is one or a few lessons that I think the Kenyan public could learn from this pandemic, is that leadership matters. Leadership matters, and political leadership matters. It is not just about voting. It is voting people that follow through their work. Now, when we talk about universal health access, now people might ask, what is this universal health access? When people have been paying for their testing, when people have been paying for their evacuation, when people have been paying for quarantining, you want to believe that that may not be very universal, and especially if your access to quarantine or testing or evacuation services depends on your capacity to pay for them, then I might ask, what is so universal about that? So leadership is very important. As a public, we could also learn that discipline is something that is very important. Discipline as a people, to discipline ourselves to follow rules. If we have had the cabinet secretary keep saying that if we treat the COVID-19 normally, it will treat us abnormally. But this could also apply to the leadership. If we continue treating our politics, if we continue treating our political discourses and debates as normal, and even some people shying away from the politics of the country, then it is not going to treat us kindly. We cannot run away from the politics of this COVID-19, just like we should not run away from the politics of this country, because the politics of this country will not run away from us.
Well, Mr. Martin, your closing remarks?
My closing comments regarding the COVID-19 pandemic. It is a disaster. It is disastrous. It is something that will forever be ingrained in the history of the world because of the impact it has had so far. But unfortunately, it will have even more devastating impact as we continue to live through it. But one thing I know is that we will survive. As a people, we will survive. We will survive, but after we have survived, so what? Are we going back to live our lives normally? Are we going back to do the things the way we have been doing? Now, I ask this because the COVID-19 has come to point out to the massive inequalities that we are in, as not just as a country but as a world. The massive inequalities, the massive gap between the rich and the poor, the massive gap between the haves and the have-nots. When you look at the number of people who even imagined or thought that they were not poor, but just going 1 month without pay or being retrenched or losing their job, they cannot afford their rent. I have seen, a lot of people, questioning where they will get their next rent from. People that cannot afford to store food and stock food or stockpile various necessities. These people are part of our society, and we must demand that the systems that are there to work for the people ensure that all of us are taken care of, that everyone's needs are taken care of. We cannot have such a society where, millions of people fear to die of hunger than just a handful of people that fear of dying from virus. Now, don't mistake that I am not saying that many people don't fear the coronavirus disease, but a lot of us, a lot of people here have seen more of hunger than of the virus, and they fear it more than the virus itself. I do not know what is worse, but we shouldn't be in a position where we choose how to die. We should not be put in a place where we choose whether to die from a disease such as COVID-19 or to die from hunger. We shouldn't be in such positions. The leadership of the world, the global leadership, must rethink its approaches in building our economies. When we overcome this, and as I said, we will overcome, we must ensure that then the systems we put in place are systems that work for us, the systems that work for everyone, not just in rhetoric, not just in chatting or talking in conferences, in very big conference rooms in some powerful hotels, some big hotels somewhere, but how whatever we discuss, how these systems can really be made to work for even the ordinary person that cannot afford to attend these conferences and have their voices heard. So it's a time it's a wake-up call for the world to build fairer systems, whether be it systems of health, be it systems of education, be it food systems, and so on and so forth. We need to have a society that thinks about everyone, works for everyone, so that's the only way we can be able to say that we are really a society to be proud of. Otherwise, everything else that we build is just built on quicksand, and it's not going to last for a long time, especially when a storm such as COVID-19 hits.
Well, ladies and gentlemen, we've come to the end of this show. Thank you for tuning in. Until next time, stay blessed.